Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I am happy to welcome Dr. Jeanne Drisko, Director and Founder of Integrative Medicine at the University of Kansas Medical Center, and nationally recognized clinician, educator, and researcher in nutrition and integrative health. Thank you so much for joining us, Dr. Drisko. I appreciate you taking the time out.
Well, thank you for inviting me.
Well, I'm really looking forward to hearing your personal story, your professional journey, and all the exciting and wonderful and remarkable things you're doing for medicine and the future of medicine and patient care.
You know, like so many people in this field, I started off with a personal story. So I was in conventional medicine, and this was in the 80s, working, 6-7 days a week. We would take night call, for a week at a time, although we shared it, but when you're on call for an entire week, you get pretty burnt out. So by the late 80s, I was a physical wreck. There were periods of time I couldn't even get out of bed when I had time off. And I can remember being in bed just so fatigued, and I can remember the sun just crossing across my bed and, just watching the day go by. And that's really a waste of, your life. So I ran into a friend, and he's a physician, a good friend of we'd known him for a very long time, and he said, well, I had just been at this A4M meeting, and this was like probably one of the first A4M meetings. And he said, I learned about these nutrients. Why don't you just try taking these nutrients? So I went and bought a couple of, like CoQ10 and some B vitamins, and within 2 weeks I was better.
What was it that you were either diagnosed with or not diagnosed with? But
I was not diagnosed with anything. They just thought I was crazy. These are friends. These are physician friends who thought, oh, she's just nuts, So I even ended up for a short stint in the hospital because they couldn't figure out why I was so fatigued. And I was starting to get headaches. And I know in retrospect it was adrenal fatigue, but I didn't know it at the time because I didn't know anything about it. So after taking those nutrients and starting to feel better, I thought, I was pretty pissed off actually because I didn't learn this in medical school. And if anything, we were told not to take supplements, it's just expensive urine, blah, blah, blah. And so I had a bias against anything natural. So I started seeking things out on my own. So I started going to conferences and learning who the thought leaders were in this whole new world, this new realm. And I finally asked someone that I met, well, is there anyone I can train with? Because you can only go to so many conferences. And Jonathan Wright up in Washington State was kind enough to say, well, there's someone in your backyard, and it's Hugh Reardon, and he was a physician in Kansas who was one of the pioneers of integrative medicine. And I called him. He said, well, come down and have lunch with me. So I went down and I had lunch with him, and he said, well, you can come train with me. So I spent a year driving back and forth from Kansas City to Wichita, Kansas, which is about a 3-hour hike. So I was committed. And it opened up an incredible world for me. I mean, I learned things from him, and he had originally trained as a psychiatrist, so he wouldn't tell me things. He would ask me questions, and then I'd have to go look it up and figure it out on my own, then come back and report to him. So it was, and he had a wonderful library in the Reardon Center, and so I spent a lot of time reading and studying, and then listening to the patients with him, and then it was just a wonderful amalgamation of tools. So after I finished with that, it was in sort of the late 1997.
How many years were you with him?
Just over a year.
Okay.
Yeah. So the dean of the School of Medicine at the time, Debbie Powell, said, that she wanted to have this kind of a program at KU, University of Kansas Medical Center in Kansas City. And the chair of family medicine was going to do it, but she decided to leave and go into private practice. So I took over building this program in 1998.
What made her want to do this?
Because everybody else in the country was doing it.
Oh, okay.
So it wasn't a belief system.
Okay.
So anyway, so I started, and at the time, there was a cardiologist that had gone to medical school with my uncle. And so he was a family friend. And I came and I started, and I saw him in the hallway, and he said, well, hi, how are you? What are you doing here? And I said, well, I'm starting the Integrative Medicine program. And he looked at me, and he turned around and walked away, and he never spoke to me again. So that was the kind of reception I had in 1998. So, but over time, I built friendships across campus and have great working relationships with the oncologists, the cardiologists, the internists, the surgeons, family medicine docs, pediatricians, everybody. Because I really feel like integrative medicine can bridge all of those gaps. And then we started, and so initially the only thing I was allowed to do was teach the medical students. And I couldn't call it complementary and alternative medicine or integrative medicine. I had to call it unconventional medicine.
Oh my goodness. Now this was its own program
in
and of itself, or was it in addition to traditional?
No, it was actually it was supposed to be housed in family medicine.
Okay.
And the director of family medicine at the time, I was supposed to go meet with her to figure out when I was going to start. So this was 1997 now. And she said, well, you can come at this time to my clinic. So she made me wait out in the waiting room with the patients. And she kept me waiting for almost an hour. And then I finally got in, and she said, well, I don't like you, although she'd never met me before. I don't like what you're doing.
She must have been talking to your cardiology friend.
Yeah. Don't like what you're doing, and I don't want this in my department. But if the dean makes me, I'll take you. And I thought, yeah, not a good fit. So I subsequently, I went back to the dean and I said, I don't think it's going to work in this department. And that at that time, Sterling Williams came to head OBGYN, and he'd been at Columbia Presbyterian in New York City, and they had a robust women's integrative medicine program at that time. So he said, well, I saw this work in New York, and I want it in my department. So I started in OBGYN. The integrative medicine program was under their umbrella, but he pretty much gave me carte blanche. So I did a lot of women's health things initially, just to be respectful of OBGYN. So I did the education continued broadly with the students, and then it encompassed also residents in different departments and then fellows, which I'll come back to in a minute. But I did some research in bioidentical hormones, which never got published because the funder pulled the funding for it. But that's on clinicaltrials.gov, and so I do have some information about that trial out there. But I also did an ovarian cancer trial with high-dose vitamin C. And
so that's where that began?
Yes,
okay.
An intravenous vitamin C. And it was because I had such good working relationships with these people in OBGYN. Well, success mounted, and so then the internal medicine chair came to me and said, well, I really want you in internal medicine. So I switched from OBGYN. There had been a chair change, and the new chair really wasn't interested in it. So it worked out really well. So I moved into internal medicine, but in the meantime, in the 2000s, grateful patients came together and funded the rehab of space inside of the medical center. And so it was fully dedicated to just integrative medicine. So it didn't really matter whether I was in OBGYN or family medicine or internal medicine, because we were really largely independent. And we were right in the middle of the medical center, so I always tell people we were the heart of the medical center. So, but we took care of patients of all stripes. And funny thing was, when I was an OBGYN, the clinic space I had at that time was in the OBGYN department. And so I'd have these male patients coming for a variety of reasons, but they'd be waiting in the waiting room with the pregnant ladies. So they were really relieved when we moved to our own space.
Sure,
yeah,
I'm sure.
yeah.
Okay, so you ran that department for how many years?
Over 20 years.
Okay.
Yes, and eventually we were able to expand the education to fellowship. So it was a dedicated fellowship in integrative medicine, and this was post primary care residency. So that started in 2008, and so had some wonderful fellows. And
now, what were you initially specializing in prior to getting into integrative medicine?
well, I started in internal medicine in New York, and I'm a fourth generation Kansan, and you know, who'd have thought? I went to KU Medical Center, but I did my residency internship in internal medicine, and I thought, oh, I just can't do this the rest of my life. So I thought, well, you know, with a family, it might be easier to do radiology, so I did radiology. I worked in the ER for a while as well. So I have this eclectic background. And then I retrained in integrative medicine with Hugh Reardon, and I actually was a fellowship. So I have this really weird background, which I don't think
I would say
works.
broad.
Yes. But it worked. It works for me. So anyway.
So getting back to your research with a high-dose IV vitamin C for ovarian cancer. So you have now written numerous articles, and you are an authority in
on
this. Can
vitamin
you elaborate?
C. Well, you know, it was interesting because Hugh Reardon, who trained me, was doing a lot of vitamin C at his clinic, and he was a colleague of Bob Cathcart and Linus Pauling and Abram Hoffer in Canada. And so I had this direct connection with this IV vitamin C world, and what I saw when I was in training with him was nothing short of miraculous. So there were people with fibromyalgia that were having their symptoms reversed. There were people with cancers having their cancers either put into a chronic disease or even reversed. And you know, that doesn't, you know, not everybody has these marvelous outcomes. I don't want to paint this as a panacea, but enough that I knew there was something to it. And so the problem is that in the 70s, the Mayo Clinic did a trial with vitamin C for cancer, and they said, oh, it has no effect. It was a placebo-controlled trial. But what they did was use oral vitamin C, and so that's a vitamin. And what Linus Pauling had been using was IV vitamin C, and that's a drug. And my colleague at NIH, Mark Levine, has shown that with his preliminary studies in IV vitamin C, pharmacokinetic studies, that it's really a drug when you put it in the vein. And it does things completely different than what oral vitamin C does. So I was sure that's the route I wanted to take. And it's so interesting because subsequently, when I was in the midst of all of this, Tony Lamas, who is a PI, the principal investigator for the TAC trial, which is the EDTA chelation trial, came to me and asked me to participate in that. And I was also, I'm board certified in chelation, so I was interested in it. But the truth of the matter is the EDTA chelation solution has between 7 and 10 grams of vitamin C in it, along with B vitamins and magnesium and some other goodies in there. And so everybody talks about EDTA, but it's really this combo. And I'm really curious to find out what are the component effects. You know, maybe it's the vitamin C. If there's no heavy metals in somebody and you're not removing heavy metals, it's got to be something else. So anyway, so I feel like I'm kind of combining this TAC trial now with the vitamin C research.
So let's talk about your new focus because of the TAC trial in regard to environmental science and toxicity and what you'll be speaking about at this conference?
Well, I got really interested in environmental toxicity in the 2000s. We had patients, then they were young. That was the thing that really bothered me, that they were like in their 30s and they were fatigued, and these are men and women. They were fatigued, they had low levels of sex steroid hormones, their thyroids weren't working, they had terrible bowel disease, and it was, why would these young people be such a mess? And so in the beginning, I started doing some specialty tests and finding that they had, I was looking for heavy metals predominantly in them because my generation was heavy metal. We were, the lead and the mercury from the amalgams, the dental fillings. But these young people didn't really have heavy metals because they weren't exposed to the amalgams. They all had plastic sealants put on their teeth. And they weren't exposed to lead because lead was taken out of the gasoline. So there was some heavy metals, but not the toxic burdens like you'd expect. So I had to rethink things, and I started doing some testing and found that they had chemicals, a lot of chemicals in their system, things that we associate with paint solvents or plastics or parabens from makeup or personal care products. They were off the chart in those things. So then I started really trying to figure out where all of this exposure was coming from, and then looking at it not only in this group but in older age groups as well. And it's alarming to me. And so, the diet has become, the food supply has become so depleted of nutrients that we're not getting this baseline help so the body can clean itself, because it wants to clean itself. It knows how, but we're not giving it the tools it needs to do it, and we're overwhelming it at the same time. So, I don't know if I answered your question.
You did. So, getting back to these patients. At the time, because you had minimal knowledge of what was causing their sickness, how were you treating them?
Well, I think the best way to think about it is when we're taught in medical school, we're up here in the leaves of the tree. We're up here at the diagnosis. We've got cardiovascular disease and GI disease and, whatever. It's all up here. But you've got to come down into the roots of that tree, right? So you have to look at the biochemistry. You have to look at, what they're taking in, what nutrients they're taking in, what the soil is like, so on and so forth. So when you come down here, it almost doesn't matter what the diagnosis is. So you start figuring out what they need and what you need to get rid of. So that's how we approached it. So laboratory testing for micronutrient levels for vitamins, minerals, good fats.
Did that exist at that time?
It did.
Okay.
It did. So these specialty labs have been around. I mean, there's so many of them now. It's just unbelievable. I can't even, keep up with it anymore. But in the late 90s and early 2000s, there was, just a handful. So I'm kind of one of those people that, I'm saying, yeah, bullshit. You got to show me. You know what I mean? So what I did was I do split samples to these labs. Every one of them got split samples from multiple, samples. And in fact, we did one where we took blood and split it into 8 samples and sent 2 to 4 different labs to see. And so I've got a high BS detector. So I figured out very quickly which labs were good and which ones weren't. So the labs will tell me what the micronutrient levels are, what fats they need, good fats they need, and if they have chemicals, what are the levels of those chemicals coming out in their urine, and then of course the heavy metals. So very dependent on laboratory testing and then replacement of nutrients. So, and that's another area we're very dependent upon the suppliers of our nutraceuticals. So you also really have to learn who has the best supply route. So there's an organization called Alliance for Natural Health, USA, it's a grassroots organization, and their role is just to protect the supply of natural products and do it through grassroots movements and political activism. Through Alliance for Natural Health, then I learned which companies were good and which ones had the best supply chains. So that was helpful because then I was able to give patients good, clean food and recommend good nutrients and do detoxification techniques, which could include chelation or sauna or IV therapies, whatever it takes to get rid of what they have too much of.
And this area has remained one of your passions, if not the most.
Well, I think if you can clean up a person's infrastructure, they're going to get better on their own. You know, you can support, and then Dr. Trindade, who's speaking here this week at the A4M conference, talks about a system where she goes through balancing your insulin and insulin resistance, and then fixing your adrenals and fixing your thyroid, and then your sex steroid hormones. And if you start down here, you know, really clean up the diet and the food, you may not need to add all these other things. So that's just a really great tool.
Even if it's from toxic exposure?
You've got to get rid of those toxins, absolutely, because they're going to gum up the works. You know, they cause mitochondrial dysfunction, big time. They cause immune dysregulation, so your immune fighting cells fall, and your autoimmune cells, you know, your autoimmune part of your immune system gets revved up. So you've got this really wacky, out of balance immune system. You get neurologic toxicity, so that brain fog. You get endocrine disruption, which this isn't even far-fetched stuff. This is the Endocrine Society of America, which is one of the most conservative organizations. They don't even believe in thyroid hormone, hardly. But they have 2 white papers now on endocrine disruptors. And on their website, they have a huge section on endocrine disruption from these chemicals. So, and then there's epigenetic binding as well to the DNA molecule from these toxins. So if you don't avoid it and you don't clean out what you have, you're gumming up all your works, aren't you? So, and that endocrine disruption can also contribute not only to the thyroid dysfunction and the sex steroid hormone dysfunction, but the adrenal dysfunction. So you're tying all of these things up in a package.
Now, am I correct in saying that it also affects the cardiovascular system? Isn't that what you're speaking about?
Absolutely, okay. Yes. So Mark Houston, who I've known now for a very long time and refer patients to because he's a fabulous integrative cardiologist, I mean, hands down, asked me to speak about heavy metal detoxification and the TAC trial. And I broadened it to general detoxification because of these chemicals. And there's a National Institute for Environmental Health Sciences at the NIH, and they have webinars all the time about, for example, there was just one about exposure to traffic fumes and cardiovascular disease. So this isn't even like far-fetched stuff. This is like in mainstream.
So what will you be speaking about?
Specifically, I'm going to talk about just getting your micronutrients cleaned up and straightened up, getting your diet cleaned up, straightened up, and then talking about general detoxification, and then heavy metal detoxification, and then the TAC trial, and some of the confusing things about the TAC trial, which everybody says, oh, it's the EDTA. I mean, it's just, okay, EDTA, you know, that's all it's all about. But when you look at the population that benefited from the TAC trial, the only population that benefited were the diabetics. So it wasn't even generally anybody with cardiovascular disease, it was just the diabetics. Now, why would diabetics be the only group that benefits from EDTA chelation? But if you look back into the solution, the EDTA solution, it's got B vitamins, it's got vitamin C, it's got magnesium, and then it has the EDTA. So if that population happened to have lead, for example, then maybe they did benefit from the EDTA. But the sad thing about the TAC trial is they never looked at heavy metals. So now Tony Lamas, the PI, has a new funded study, the TAC2 trial, and they're going to replicate the study exactly in the diabetic population to see if it was real. So I think we're missing the story here. I think, and maybe it was a proof of concept kind of a thing, but $30 million proof of concept is pretty expensive.
Right.
Yeah.
And these were insulin-dependent diabetics that were on?
They were diabetics.
So you've spent the last 30 years now doing integrative? Mm-hmm. Okay. So why has this field become so important to you?
I tell you, the most important thing, and this is what I try to impart to the fellows that are trained, is the patient. And I think there's such rampant burnout now in medicine, and it's because you used to have this close working relationship between patients and physicians. And you'd know the family and you'd follow these people their whole lives. But now it's like the insurance company has insinuated themselves, and big pharma and big medicine has insinuated themselves in between that relationship. So you've fractured that relationship, and physicians are unhappy. Most of the time people go into medicine for altruistic reasons. You kind of get it beat out of you a little bit, but generally most people go into it for that reason. And then when you lose that reason for why you're doing something, you don't enjoy it anymore. So I couldn't do that kind of medicine. I would quit. But when you can work with somebody and take somebody that has a chronic debilitating problem and make them better, it's satisfying. And then you have this relationship with people. We call what we do resort medicine, and it's not because you're going to the spa. It's because they come to you
as a last resort.
Last resort, yeah. So, and they've seen, 4, 5, 6 they've had procedures, and they're generally told to go see the psychiatrist. And, they're not crazy. It's physiologic. It's not there's some psychological component to it after a while, but generally it's physiologic, and you just have to look in a different way to find it.
So do you have any of your most complex patients that you can share one of your success stories with?
Well, there's a lot of them. There's one patient that I'm sharing as a case study in the cardiovascular meeting, and he had come from out of state to visit and came with a long list of medications and a history of ongoing debilitation. He was barely even able to walk 1,000 steps a day, but he'd been to I can't even remember, he said maybe 20 different physicians.
Oh,
a lot, including some integrative people in his neighborhood, and they were unable to really get to the root cause. But he had been, and he was more of the baby boomer generation, so he had had heavy metal exposures, and he was in the building industry, so he had a lot of exposure to building materials, which are super toxic, drywalls, paints, you name
Caulking.
it. Yeah, caulking, everything. So he was pretty toxic. So and his gut was a mess. He was eating garbage food, and he'd lost his business with the 2008 downturn, and so he was pretty much homeless almost. He lived in this house he'd gotten through some sort of a Homestead Act. So if you live in an abandoned house and start rehabbing it, it's yours. So he decided, well, I've got the skills, I'm going to do that. So, and then he watched, I can't remember, one of the Super Size Me. That was the video he watched. And he decided, well, that's me. I'm going to change my diet. So he started changing his diet. He started feeling better. and rehabbed his house enough, but he still wasn't off all of the, he was type 2 diabetes, coronary vascular disease, had been stented, hypertensive on 5 different medications. So that's how he was when he came to us, and still about 65 pounds overweight. He'd been 100 pounds overweight, but now he's only 65 pounds overweight. So when we do our intake, we like to see where the majority of the symptoms, and the majority of the symptoms were around his GI tract. And then the other ones were fatigue and joint pain, that kind of thing. So we cleaned up his gut, cleaned up his diet further, took him off some inflammatory foods, and got him eating a whole foods diet. And I work with 2 dietitians that are integrative trained and master's level. And I tell you, if a physician is not in an interprofessional model where they're working with key people like dietitians and movement therapists, and we had neurofeedback, we have all of these tools, a naturopathic doctor, we have lots of tools, lots of different people throwing in what they think is the right thing to do in an interprofessional model. You just can't really do it all yourself. You can't. So anyway, cleaned up his diet and got him off the inflammatory foods, blah, blah, blah. Then he started feeling better, moving more, got up to 10,000 steps a day. And then we were able to get him off of his medication, reduce more and more medication. He reversed his diabetes and got rid of his heart failure. And, he's now on maybe 1 medication. So the Cinepril, I think, is the only thing his cardiologist left him on. So, so he's now functioning. He's back in the community. He's starting to help people in his community, vets with PTSD. So he's giving back now.
Unbelievable.
Yeah, it's pretty cool.
So had there been a program available that similar to the program that you founded at UK, had there been a program available when you were starting out in medical school? Do you think you would have been drawn to that even without your own personal health issues? Or?
I don't know. I've thought about that before. I believed what my faculty professors told me, that was silliness. And when we teach the medical students now, there's a level of skepticism. It's hard to touch them. Even though I'm there and they can come and they can take a class, a month-long class, a rotation, it's not popular. But it's the residents and then the fellows and then the practicing physicians that are out in the trenches that realize, this isn't going to work. I need to do something additionally or different. Those are the ones that you're going to touch. But the medical students, I don't think I would have probably either at that level. It took a personal experience.
What words of wisdom or inspiration can you share to that young, 19-year-old who's in college and thinking about applying to medical school, that would potentially, sway them to follow an integrative path from day one instead of finding out?
Well, the first thing that they should never do is say that in a medical school interview because they will not get accepted into that medical school. So that's what I always tell them. Please do not bring this up in your interview. You're going to go into some, underserved area and, be altruistic, which is what a lot of them really want to do anyway. But never mention integrative medicine. But then think about how you can take care of people in the very best way. And I think that's what they need to understand, is that what they're going to learn, and there's the old saw that, what you learn in medical school, 50% of it isn't true, but you don't know which 50% it is. Keep an open mind. And don't just read New England Journal of Medicine, for example, because those authors are generally funded at the tune of $1 million+ a year by the drug companies and device companies. But read broadly. Use your own brain, figure out what is the truth and what isn't the truth. So, and be a lifelong learner.
Ironically, you stated earlier, I don't know if we were on camera or not, when I asked you about your passion, and you just said patience, and you just seemed to indicate that again. So it seems as though if you really want to take the best care of your patients, then you have to practice integrative medicine. You have to get to root cause. And there is no other real medicine.
You know, the funny thing is, the medical doctors and doctors of osteopathy think that they invented this root cause thing, but it came out of the naturopathic tradition. And I always give the naturopaths a lot of credit, because they were the eclectic doctors in the early 1900s when Flexner drove them underground. And their tradition survived until it started coming back up again with the reopening of naturopathic medical schools. And they really kept those traditions alive. So I give a lot of credence to the naturopathic medical model.
So with all of the new modalities that are coming down the pike, so to speak, and technologies, and the awareness of our environment and what's happening, and more people becoming activists, what are you most excited about for our future?
Well, you know, I think that this whole medical system is going to be upended. I think it's going to be disrupted. There's all of the biohackers out there now. I don't know if you ever watch any of that.
Dave Asprey's one of my
I know,
heroes.
isn't it?
Right.
It's amazing that these people are reading the literature and then trying to figure things out and then upending. I mean, they're going to take over, and now you have large corporations that are hiring physicians to look at ways to bring medical care in-house to these large organizations or disrupt the insurance industry. So this medical cartel, I think, is really, they don't think that, I don't think they believe that they're going to be disrupted, but I see it happening, and I think it's going to happen pretty quickly. So it's going to be a problem for patients for a while, I believe. I can't quite see what's going to happen yet, but this entire pharmaceutical insurance model is not sustainable.
So in the interim, for the patient that is unable to afford seeing an integrative physician who's on a fee-for-service model, what suggestions would you give to them? Just little nuggets that they can change their life on a day-to-day basis.
Well, I think the most important thing is diet and lifestyle. I mean, that is 80-90% of it right there. If they could change just the type of food that they're eating and choosing, and you don't have to do it all overnight. You can just take baby steps. There's the old model of how, the food you select, the old pyramid model with a lot of grains and carbohydrates and that kind of stuff. There's a model now of a plate that one of my colleagues in the UK developed, and it's beautiful. It has all of the colorful vegetables and fruit really filling half the plate, and then about 10% of it is the good fat, from like avocados, etc., and which is just practically omega-9, so you need others, and then good quality protein, including fatty fish, that's high quality, and very little carbohydrates or grains, and then clean water, and just change some of that. You're going to go a long way in helping your body and helping your mind be able to think better and feel better. You cut down on the inflammation in the body, and the depression goes down. So that'll give the person even more incentive to do something next.
In working in the environment that you've been in at University of Kansas Medical School, and you've had to deal with so much criticism from your colleagues, what did you use? What tools did you use to combat any of the criticism?
I really didn't try and fight any of it. I just kept my head down, and I kept my blinders on, I guess. and just look down.
You didn't let it derail you. You just kept going. Right.
I looked down at the end of the tunnel at what was right and where I wanted to go, and just focused on that.
It's so often that you'll have a physician who's teetering with the idea of getting out of the ER or getting out of their normal practice, but they're so scared and they're so frightened to take that step. So what advice would you give to that physician?
I think physicians tend to be very receptive to what the other person's thinking. There's just personality types that go into different things, and physicians happen to want to please their colleagues. So they're afraid of what they're going to say about me. But at the end of the day, when you make the patient better and you're doing some things that they may not agree with, but the patient's getting better, feeling better, that speaks volumes. So you almost, at the end of the day, don't care.
That's the true Hippocratic Oath right there.
Right there, it is. Absolutely. I hadn't thought of it that way, but that's absolutely correct. But you don't care what your colleagues are going to think, because you're trying to do the right thing.
Well, thank you so much for your time, Dr. Drisko, and I hope to have you on the program again soon.
All right. Well, thank you so much.